Afternoon. Welcome everyone to the COVID Unwinding Update meeting from the Alabama Medicaid Agency. We appreciate all those that came today. We have a great crowd in person. We also appreciate all of you who have logged in online. I do think this is getting close to a record number for one of our webinars. So thank you for taking time out of your day and joining us. Thank you for the opportunity to convey this information. Please be mindful as we get started that you have been placed on mute. If you're in the room and you have a device, please make sure those devices are muted. If you've joined us online, please keep your device on mute so you don't disrupt the speakers. Okay, and questions can be submitted all throughout the presentation. The way this is going to work is those that are in the room, we're going to allow you to ask questions first. You'll have first access at the microphone at the end of the presentation. Then we will look at questions that have submitted to the chat box. So if you've joined online, you can submit your question at any time through chat, and we'll address those next. And then lastly, if you've joined by phone only, you can send your your question in by email. And I'm going to give you that web address now. It's webwork, WEBWORK, @medicaid.alabama.gov. And this mailbox will be checked during today's presentation. So if you've joined online, put it in the chat box. If you've joined by phone, send it to webwork@medicaid.alabama.gov. Any questions that are related to today's topic will be addressed. If you send in questions that are off topic, we're not going to necessarily answer those in today's meeting, but we will try to get a response to you individually. It's really important that you record your attendance. Those that are in the room, if you will make sure that you've signed in on the sign-in sheets just outside the room. Those of you that have joined online, go ahead and put your name and the organization you're with in the chat box now. And if you submit a question that might be off topic that we're not going to get to today, you can submit your email address as well. So as we get started, I want to go ahead and introduce Commissioner Stephanie Azar.
Hello, everyone. First, let me thank y'all for being here today. It looks like we do have a record number of folks in the room and on the line, so that's awesome. We really appreciate that because everyone knows how important the unwinding period is going to be, and you guys are all our partners in helping us ensure that we do this the best way possible. I'm going to start first with just a real quick COVID-19, where we started. I think it's important just to kind of remind, I think most everybody kind of knows where we are with that. But as everyone knows that in March of 2020, we began our national COVID public health emergency, actually began. And during that time frame, recipients were allowed to maintain coverage during the PHE and were also only could be taken off if they left, moved out of state, were deceased, or asked to be taken off, basically. So as you know, our enrollment's been going up due to not being able to take them off, and we've referred to that as maintenance of effort, or MOE, numerous times. Medicaid recipients have also, at that time, we had to have allowances such as no copays for provider visits or prescriptions, no referral requirements, telemedicine visits in ways that we had never done before, and just a multitude of other changes that many of you are aware. So that's kind of where we started. So today, the main reason for this call, there's a multitude of them, but one of the main ones is that we're actually entering the unwinding period, and we've been on hold for that for a while. So it's important to know what is changing. And I like here how we kind of separated it out. As you can see, beginning March 2020, we had the COVID public health emergency, which is what PHE stands for. And now you can see what has happened under the Congress enacted the Consolidated Appropriations Act, the CAA, in December of 2020, just a short while ago. And what it does is it decouples, that's how they refer to it, which basically means it is now separating out our maintenance of effort, having to keep people on, from the public health emergency, because before those went hand in hand. We couldn't take anybody off until the public health emergency ended. Now they're two distinct dates. What today's call is really focusing on is the continuous enrollment ending March 31st, 2023. That's the main reason for the call today. Medicaid will begin terminations of coverage on April 1, 2023. That's what the CAA tells us we have to do. It's no longer us wondering when that will be, but that is when our official unwinding will begin. Most recipients will maintain their normal renewal times as to being on the program. And as you may or may not know, there is a phase down of the federal matching rate. We've been getting an enhanced 6.2 for the every quarter that we've been in the public health emergency. And now that it's separated out, the funding does not go away when the public health emergency ends in May 11th of this year. So we will have a phase down approach, which is actually good news. It allows some extra dollars to assist with the unwinding process. So, and also on this chart, you'll see that the COVID PHE actually ends May 11th. So it's very important that those are two distinct different dates. So I believe that's the main point that we want to have there as well. This next slide just kind of reiterates what we just said. It can get very confusing if you're not in it every day as to what those mean. So what we're talking about today is the continuous enrollment or that maintenance of effort. It's all related to eligibility. Renewal forms mailed annually. Like we said, most are going to get their regular renewal period in that 1 year of unwinding that we have. If mailed a renewal notice is returned undeliverable, then the agency has to look to two more modalities or two different ways of reaching out to them. That is new. That was added into the new law. A multitude of other reporting requirements and everything came out in December with the CAA. And one of those is we have to make efforts in two more modalities, texting, email, things like that, to try to reach out to the recipient before we can take them off. So that's a new rule or regulation put upon us as well. A multitude of others, but that's just one example we wanted to give today. And then the public health emergency here on the other side is related to services. Okay, and most of y'all know a lot about that. We waived co-pays. We implemented telemedicine in a way we've never done, signature requirements, referral requirements. All of those, most all of those, there's a few that don't. It's very, very complicated, as all of you know, still will come to an end on that May 11th public health emergency date. So that's not what the call is about today. What I will reassure you in is like when we reinstate co-pays, because we're going to, there will be sufficient notice giving out to the provider community through a state plan change notice that we have to do, through an alert or whatever that will be, to make sure that all of you know that. Our goal would be to probably have anything that we're trying to enact to be May 1. I can't be held to that because we don't know how the approvals will go or what CMS is going to outline there, but the provider community will get sufficient notice of everything that we are doing in relation to the services side. And last, I just wanted to kind of go over key dates to remember. You might want to take a screenshot of this for you who are not in the room today. It just reiterates those very, very important dates. The March 31st date, which is fastly approaching. The continuous enrollment condition ends. That means simply we can begin to terminate those that otherwise have only been on the program because COVID and the public health emergency had them remain on the program, meaning they're otherwise ineligible for the program. We can begin taking those individuals off. That's actually in the law. So we may begin actually terminating in April of this year is how the law is saying that we can do that. And as I mentioned a moment ago, May 11th will be when the COVID PHE actual end date is, which really refers more to the services now. So them separating it out confused it on one end, but made it much simpler in some other ways, in my personal opinion. So I just want to thank everyone for being here today. I know the staff has got a lot of good presentations to go over with you today, and I know they've worked really hard. You can have opportunities to ask questions. I encourage you to do so. We will do all that we can to answer those questions. And I just want to say one more time how much I appreciate all the stakeholder bases who have helped us over the past many, many, many months, communicating with the recipients to change their address and do all of those things, which is very, very critical that we do this correctly and that we don't take off individuals who are otherwise eligible. So we're working really hard to do this as thoughtfully as possible. So thank you, and I'll turn it back over to you, Melanie. Thank you.
Thank you, Commissioner. Okay, most of you know my role is communications. I'm communications director for the agency, and my staff and I have been working very hard to put together our toolkit for communications throughout this process. We've constantly kept it up to date as much as we could, as quickly as possible. And a lot of the messaging is very thoughtfully put together. I want to emphasize that because as providers, we want to make this simple for you. We don't want providers and Medicaid partners trying to come up with their own messaging. We'd like for you to share what we've actually already put together. It's so important that you share the same message because We don't want to confuse recipients. We don't want them to read it one way and then read it another way according to someone else's interpretation. This is the official messaging from the agency. So we ask that you share all messages just as you see them written and not try to reinterpret them. For instance, a lot of the national correspondence that I've seen suggested is that redeterminations will start April the 1st. Well, in Alabama, that's not true. We've had redeterminations all along. We have continued to have paperwork going out to recipients and asking them to renew even throughout the pandemic. However, now is the time they really need to pay attention. They have to turn it in now. So with that in place, I want to go over our key messages that we've developed. They sound pretty simplistic, and I said that before in our last meeting, that these are very simple messages, and it's designed that way so that we don't confuse people and we don't overwhelm them with information that they might not necessarily need to know. There were some national experts on a lot of calls that I've attended where they had a communication expert that said you really don't want to mention public health emergency or the term unwinding with a recipient because they are not aware. They haven't been in the weeds like we have about what that means. And so we just really want to put a message out, what's basic that our recipients need to know. So I kind of want to go over this. Phase 1 of our messaging plan is get ready. And I will just read it to you. Renew your Medicaid every year. Stay up to date about changes that can affect your benefits. Update your mailing address and other personal information with Alabama Medicaid agency as soon as possible to get notified. Now, most of you remember in phase 1, we had these yellow postcards. Now, I have one in English and one in Spanish. We can translate it to other languages as needed. So if you'll just let me know if you need another translation. But these are the predominant top 2 languages in our state. So that's why they're put together this way. They do have a QR code at the top. So if you have a Medicaid recipient or an advocate with that recipient that could scan that QR code, that's how they can change their address. We tried to make the message simple so that they understood exactly how to update their addresses. So this message does continue and probably will continue well after the pandemic. They're intentionally designed this way and worded this way so that they never go out of date. We always will need updated addresses, even when we're not in a pandemic. So that's why it's done this way. The second message is check your mail. So starting April the 1st, Medicaid will mail you a letter to let you know it's your time to renew. You must fill out and return your form to Medicaid, and coverage will stop if you're not eligible or if you don't respond. Medicaid will mail you a letter letting you know if your benefits change. So just as the commissioner alluded to before, at the end of the PHE, there will be some changes to services, like they will have to start paying co-payments again. They'll have to start getting referrals again, things like that. So just be mindful that in your offices, your doctor's offices, or those that are advocates that are working with recipients, these are the key dates that you need to make sure your messaging corresponds with what we have together here. Now, starting on April 1st, we will move into phase 3. That doesn't mean that phase 1 and 2 goes away. That means we now have 3 messages. We have phase 1, 2, and 3. So not only update your address, start looking for a letter in the mail, but also renew your coverage when your renewal form comes. And so after April 1st, we will be into phase 3 of that messaging. So I talked about the yellow postcard campaign. These were distributed to provider offices and pharmacies and Medicaid partners throughout the state. I think you guys are probably tired of hearing about the yellow postcard, but I did want to mention it just in case we had somebody new or somebody who didn't get to hear about it. So let me know if you do need yellow postcards. Form 295 is the official change form for recipients. This is how they update any information with the agency. So I did put the pathway on here. If you go to medicaid.alabama.gov, you select the recipient tab and then forms. From the drop down, you're going to say, you're going to scroll to the second section of forms, and you're going to see Form 295, and it's available in English and Spanish. Now, I will share these slides as well with anybody that we'll post these to our website, I'm sorry. We're going to post both the recording and the slides to the website. So all of these links will be live in those slides, and you'll be able to go in and find this information. But it is important if you are a provider in a doctor's office and someone needs to update maybe their family size or their income, their address, or if they've had a baby, any of that information can be updated on this form. So if you wanted to print just a stack of these and have them available at your check-in or check-out counters of your offices, that would be really convenient for recipients. Now, the recipient notice is going out now to households. As you can imagine, we have a large quantity of these going out. And in these recipient notices, again, we tried to keep the information included as basic as possible. And only vital information that a recipient needs to know is included in there. So it does inform them that if they are found ineligible at the time of their renewal, that they would be terminated. We used a little bit different language in there. Don't worry, that's not the language I used. But they will receive a letter if they have benefit changes. They will need to renew their coverage when they get the form in the mail, and it should occur on their normal renewal month. That is for most recipients. I think there might be a few exceptions, but for most recipients, they are used to renewing a certain time of year or a certain month. We're going to keep it on that regular month on a regular basis. Sure. The question is, how do they find out what their normal renewal month is if they're not aware? Maybe they've just gotten Medicaid since the pandemic and they haven't had to renew before. They can always call the recipient call center line, or if they have access to the Medicaid portal, they could go to the Medicaid portal to look that information up. So if they no longer qualify for Medicaid, there are other resources outside of Medicaid, and we want to make sure that they have links and access to that information. And we did include that in the recipient notice that went out. Okay, now on the screen, I want to show you, we're really proud of these. These are two of our resources we developed specifically for recipients. Now, those of you that are in the room, you have got a copy of these, and I'm going to have some links included to these resources. They're in the toolkit, the communications toolkit. On the left side of your screen, you say Medicaid recipients, keep your Medicaid at the top. And what this is designed specifically for Medicaid, it has all three of those messages that we talked about just a little while ago. So it's got the QR code on there if they need to change their address. It does have check your mail, and it has the basic information from there. And then thirdly, it talks about the renewal, completing your renewal form and how important it is to renew. So the box that you see on the right of your screen that says check your mail, this is actually our social media post. Here again, we tried to keep that message just as simple as possible so there's no confusion as to what we're trying to communicate. So as partners, if you're sharing this on your social media sites, what I ask you to do is maybe say important information from Alabama Medicaid and just post that box. Just simple. You don't have to do any explanation along with this.
If they had coffee.
Thank you. For those that are joined online, please make sure you keep your lines muted. Thank you. We have someone joined that's not muted. Please mute your line. Thank you. Okay, we'll continue now. The provider resources I have lined up on this page or on this slide, this tells you the navigation of how to find information for providers. Now, those of you that were in this meeting previously, I'm lumping together providers and Medicaid partners. So all of the resources for all Medicaid partners, including providers, are located on this page. It is a resource page to give you all the recent updates, including the continuous enrollment being brought out from the end of the PHE. It's got the key dates on there. We have links to all of these resources on there, including the second phase toolkit. And we also have on here the social media post where you can just grab that social media file and you can post it on your sites. You could also go to our Facebook page and you could grab it off of our Facebook page and share. So this next resource is one that was requested by some providers. As you know, we've had a lot of help from CMS, from NAMD, and other partners nationally, and they have put together some really nice resources and packages that have helped us in developing our communications. So I want to give them credit. This is where this originated from, but we put in our specific state messaging in here. And this is not a flyer that you give out to a recipient. This tip sheet is strictly for a provider's office or partners who are talking and helping recipients. And the reason we developed this is you may encounter some recipients who have lost their coverage. Maybe they're checking in for their appointment and you're verifying insurance and you realize, oh, they no longer have Medicaid. So to assist them, this is sort of a dialogue to guide your conversation that you have with that recipient. First, you're going to ask them, did they update their contact information with the agency? If not, they may have missed their renewal notice, their time to renew. So then they need to go back and reapply. If they did keep their information up to date or they've not moved, the second thing to ask is, did they get a letter about their coverage? If they did, but they didn't turn it in, maybe they said, well, I've gotten that for the last 3 years, but I've never had to fill it out before. Well, things have changed. So you might be the first person to talk to them and inform them that we're now needing them to resubmit their renewal packets and apply. So thirdly, if they have completed those 2 steps and they are no longer eligible for Medicaid, the third thing to do is to help them find other resources. And so at the bottom of this tip sheet, we have some links to FQHCs, to some free or reduced nonprofit clinics. And then also 211 is an option. That's a resource to help them find the care they need. And I know there's many others, but we are going to keep adding to that resource list on the website so that you guys can have the tools you need and the access to help those recipients. And those that are in the room, I did include that flyer here too, if you want to take that back with you. Okay, the next thing I want to show you here is a drop-in article. This is something new that we've not actually had in the toolkit before, but we added the drop-in article so that you can have an article that you can just grab directly from the website or the toolkit and put it into your newsletters. You don't have to think about writing the article and how am I going to put this information together and word it. That's my job. I've done the hard work for you. Now, this actually has been the drop-in article up until today. So after this meeting, I'm going to be going upstairs and updating this. Right now, it's got our link to today's meeting to make sure that everyone would come and join today's meeting. But I'm going to update this, and when we have a recording of today's meeting, it's going to go at the bottom of this. But we'll probably keep adding to this drop-in article current information as it's updated and as we get guidance from CMS. I do want to make sure that recipients are aware of how to find help face-to-face. Maybe they don't have a cell phone. Maybe they don't have access to a computer, or maybe they just want to go and talk with someone face-to-face. We do have offices all over the state. We have district offices, we have outstation workers, and I've got the link here just under where it says Medicaid office locations, and the information below that link is directly off of there. That's where you go to find information in person. So hopefully they can find a district office they could visit, or some of our outstation workers work with some of our partner agencies, or they work in hospitals and they can actually talk with someone in person at each of those locations. If you need help finding someone to talk to in person, I'm sure you could reach out and we could get you those resources that you need. So to end my section of the presentation, I just want to do a reminder. This is what are we doing this for? What is our overall goal? And the overall goal of everything we've put together is to help our eligible Medicaid recipients who qualify for Medicaid to keep that coverage. We don't want any unnecessary loss of coverage. And so getting the word out, having our partners help get the word out and share the message that it's time to renew, and you have to renew over this next year. It's really important that you help us share that and to make sure that they keep their contact information up to date so that when it's time to renew, they actually receive their packet. Okay, so I'm now going to turn it over to Gretel, and she's going to talk briefly about unwinding and eligibility and some other areas.
Hi, I'm Gretel Felton. I'm Deputy Commissioner for Beneficiary Services. So I am over the eligibility staff at Medicaid all over the state and all of the eligibility and enrollment processes. So as Kathy would probably say, I'm the queen of unwinding right now in Alabama. And I am happy because I think that the commissioner and you told just about everything that I had to say. The main thing about unwinding is that it is for a limited time and it's for the people that we put on during COVID unwinding, the people that we renewed. And remember, Medicaid kept doing applications. We kept doing renewals. So a lot of the people, we know they were eligible the whole time and they've been eligible the whole time. But there is a group that came in during the unwinding period. Maybe they filled out an application the first year and the next year they were ineligible. Guess what? We kept them on. There was another group that never filled out a renewal at all. We kept all of those people on. And so that's really what we call the unwinding group or the COVID group, because it was only because of the COVID-19 emergency that we kept those people on, and they were only people were only allowed to be removed from the program if they moved out of state, died, or requested to be terminated. And I don't think we've had anybody that requested, just to be honest. So we do have kind of a hybrid approach because we have different eligibility groups and we have to unwind mostly all of those groups. The groups that we have are what we call the MAGI group, and some people call it family Medicaid. It's Medicaid for parents. It's Medicaid for children under 19, pregnant women, people that are on the Plan First family planning program, and parent caretakers. And there are several other groups that are on that same application. The breast and cervical cancer program participants are on that application. And so that one is a little bit different because you may have, 5 people in one household and you're renewing them all at once for different programs. They have different eligibility rules for different groups. And so you're renewing all of those people at once. So that's the biggest group. So it would be very difficult to split up those families to renew one person and not to renew the other people. So those renewals will remain in place as they are. We have our Medicare Savings Group. That's another fairly large group. Those are individuals that are on Medicare, and Medicaid is paying their Medicare premiums. And sometimes there are other copays that are being paid as well. And then there's our elderly and disabled group. Those are people that are in the nursing home or in HCBS waivers. And I see some of the nursing home people and the HCBS waiver people are right here to hear this. And we will most likely keep those renewals as they are. Now we have a few other groups. They're much smaller. We have our DHR foster kids. We will renew them as we normally do. We don't really renew them. DHR renews them. Then when they go off of DHR, most of the time they go from foster care to what we call former foster care. And then we have our DYS youth, which they could possibly be renewed in a different coverage group as a sober child if they're no longer in DYS. The only group that we will be dealing with that is not really in the unwinding group, those people that were on SSI and they're only on Medicaid now, their SSI has terminated and they are now on SSI, we will have to not actually renew them. We can't renew them for SSI. SSA does that. But we will be determining if they're eligible on it for another group. And just to let you know, the states had an option of when we would renew. We could renew February, March, or April. Most of the states have chosen April, and Alabama Medicaid has chosen to start in April as well. When we renew, we will make sure that each person, that we send them their renewal, that we give them the information that they need, and that we check to make sure that we determine their eligibility on all bases that they might be eligible for. We're not going to terminate them if they may be eligible for another program. So we will do that. That's our due diligence that we're required to do by federal law. And if they're not, then after April 1, that's when we could terminate that individual. Now, there is something, I think Melanie talked about it, is the return mail. That is something new that CMS added right before we got the information about how the unwinding was going to go, where they determined that if we get return mail, so if like a renewal comes, but it says they're no longer at that address, then we have to try to determine if we can get a good address for that person. And then we have to at least have 2 attempts in 2 modalities. So we could try to call them, we could try to text them, we could try to email them, but we'd have to make 2 other attempts to try to get in touch with them to get their correct information and to renew them somehow. So that's going to be a little bit challenging. Hopefully not challenging, but it is new. So it is something that we will have to look at. The difficulty in that will be when you get the mail and then matching that back to that recipient. And it's not like the renewal mail is going to be just by itself. You're going to get all kinds of mail. And so that's one of the difficulties, but we're looking at extra staff to help with that. We are hiring individuals just to help with the return mail. And we're also talking with other states and looking at how we can use technology to make that happen. Am I supposed to be? Okay. Yeah. We're also continuing to hire extra staff to help with the processing of applications and renewals. If we do get contract staff, the thing about it is that they can assist us, but they can't make an eligibility determination by federal law. So we would have to have merit employees to be able to do that. So we still need all of our staff, and that's going to be crucial. But it would be a help if we can also get that assistance. Now I would like to have one of my staff members, Marie Dean, talk to you about training for application assisters. That's where you can help perhaps in our unwinding efforts when you have people that come to your office and you can assist them in completing out their Medicaid applications. Thank you.
Good evening. I am Marie Dean. I'm the trainer for the application assisters, and it's a good program. You'll be assisting our recipients who will come into your facility to apply for any of our or many of our Medicaid programs. Basically, you will come out, do the training. The training lasts for about an hour. It's through a webinar. After you've completed the training, you'll receive a certificate of completion, and your certificate will be good for 2 years. After the 2-year span, you're required to return and go through another training, just basically updates on maybe changes that have happened within that 2-year span on policy and other Medicaid procedures. My contact information is here. You can contact me either email or you can contact me by phone. So I do have some dates, training dates here listed. So if you would like to be trained, simply send me an email or call and I can sign you up for any of these dates. These dates are optional. I am flexible. I do try to train maybe once a month, but if it's a need for extra training, especially due to the unwinding, then I can make that change for you. Melanie had mentioned earlier about the 295 change form. Just wanted to give you some little more information about that form. As she said, it is out on our website. You may encounter clients who come into your office who may need to report changes of birth of a child, address change, income, marital status. These changes, basically we need their most recent and accurate information in order for our staff to be able to enter the correct information into the Medicaid system. If you are assisting, if you do decide to come through our training, then you would not only be assisting applicants with completing applications, but completing that change form. So if it's anyone in the room that would like to become an application assister, please feel free to reach out to me at any time. Thank you.
I also want to mention a couple of new programs that we have available, or new eligibility groups. It's not really an eligibility group, but we have been approved to allow for 12 months postpartum for all pregnant women. So that will allow a lot of the women to remain on Medicaid. And we've already adjusted in our system. So if they're in the pregnant women group, they will get 12 months postpartum. If they're in a different group, we have to also give them 12 months, but we're going to give, so like if they're on MSP, we'll give them 12 months of the coverage that they already have. So we'll give them the coverage that they already have if they're not in the pregnant woman group. If they're a child, of course, we will give them additional 12 months postpartum. And then we also have another program. It's probably going to be a small program, but I will mention it to you, and that is that effective January 1, if we have a program called former foster care for people that aged out of foster care, but Alabama was only providing that to those that aged out in Alabama. But there's now a new federal rule that says if they aged out in another state and they aged out after January 1st, we have to also put them on our program in Alabama as well, just like we would the former foster care in Alabama. So those are two new options that give individuals a chance to remain on Medicaid during this unwinding period. And I know that's going to be beneficial for them. Does anybody have any questions? Oh, sure. Yes. Thank you.
Can we still do the
Okay,
virtual-
we are going to transition now to the question and answer time. And in order to do question and answer, we're going to start with questions in the room. In order to make sure everybody has an equal chance to hear the question, I'm going to ask those in the room to come up to the front here and ask your question at the microphone. And that way everybody can hear the question, and it's also included in the recording. So come on up if you've got a question. And y'all are welcome to form a line if you'd like to.
So I had a question that I was going to ask the commissioner, but she'd already left. But the May 11th PHE end, is this like it always was, where it could be extended, or is this the final deal? Because I know Congress was trying to say, let's finalize this. So I just wanted to know what the update was on that.
This end date is different from the others. As you notice, it came from the Biden administration, came directly from there. I can't imagine that they would change their mind on that. So this is very different from the other extensions. May 11th, from my understanding, is a very firm date. Of course, federal government can do whatever they would like to do. They pass the information down to us, and the most current guidance that we have is the Biden administration announced that end date. So we are planning for that to be the end date. Any others that need to respond to that? Great.
Good afternoon. A couple of questions. On the information Ms. Dean was just sharing about the training for the application assisters, is that going to be in person or Zoom? It will be virtual. Okay, thank you. Another question I had is when you were talking about, when Kathy asked if someone wasn't sure their renewal date, and you had made the comment about the portal. So if it's where a provider has access to the portal will let them also know that renewal date?
So the portal I was referring to is My Medicaid. It's actually a recipient portal. Recipients can log in and see their own information in the My Medicaid portal. I will say that if they did their original application online, that application is actually our CARES system. It's different from My Medicaid, so can be a little bit confusing, but there are two recipient portals. My Medicaid is the original one, and then CARES is the second one, and it just depends how and when they entered their information and applied for Medicaid. But if they already have access to that portal, they can log in with their login ID and password, and they can look to see when the renewal will be. The easiest response for you as a provider or sister agency, if they're unsure what their end date is or when they need to renew, give them that 1-800 recipient call center line and have them call and talk with a person on the recipient call center line, just to avoid any confusion. We don't want them to look at the wrong date in the portal, perhaps. We don't want any confusion in there. So perhaps the best response is, here's the recipient call center line. It's toll free, and just let them call in and find that.
And just one final question. I know Commissioner Azar said that today was focusing on the continuous enrollment, but she also made reference to the public health emergency and the changes that will happen with telemedicine, co-payments, referral requirements, and signature requirements. Will there be an upcoming similar forum to discuss those areas as well?
To my knowledge, we've not scheduled a meeting, a provider meeting. That doesn't mean that we wouldn't have one, but currently we do not have a date on the calendar to have that. I think what she alluded to is there's going to be definitely an alert. So as long as you are subscribed to our provider alerts, those are the official communication that come out from the agency. Anytime we have a change for providers, whether it be a billing code, procedure code, change to anything with coverage, it's going to be communicated to providers through a provider alert. That is the official means. And after the meeting, I can get with you if you are interested in subscribing to that, but you also can go to our website, and down at the bottom footer of our website, it gives you instructions on how to subscribe. So we try to make it quite clear when there's a change like that. If a provider meeting is needed at that time, we'll talk about that, but right now we don't have a date scheduled. So thank you, great questions. Anybody else in the room that has specific questions, come on up front.
Hey everyone, this actually might be a good question for discussion afterwards, but my organization has 22 navigators that are certified and trained in application assistance through healthcare.gov, and they have all completed or will be completing the Medicaid Assister training by the time the unwinding begins. How can we best support the work that you're doing with the communications that are going out to try and lead people to enroll Alabama if they are no longer eligible for Medicaid?
Okay, I think your question is, how can you best help recipients during this time, those that have been trained? And I'm going to pass the microphone to Gretel or to Marie, but first of all, just making sure that you're aware of any recent alerts that have come out. Those alerts are posted on the website. And so you just want to make sure, if you're not sure where to find those alerts, you go to www.medicaid.alabama.gov and you click on Newsroom, and there's from the drop-down menu, just click on Alerts. And we have everything. I think we have up to the last 6 years of alerts posted on there. So making sure they're aware, first of all, of any recent changes, but also make sure that what they're communicating is accurate to what our messaging is. So you had a follow-up?
Actually, my question was more related to how Enroll Alabama can support Medicaid to funnel recipients or former recipients of Medicaid to Enroll Alabama to help them enroll in health insurance through healthcare.gov.
Well, first of all, let me just say that we have a system called the CARES system, and in that system, individuals can apply and be enrolled in Medicaid, All Kids, which is our CHIP program. And then if they're not eligible for Medicaid in Alabama or All Kids, we would automatically send their information to healthcare.gov. So that's what we do already. I don't know, maybe we can have a discussion offline to talk a little bit more about what you do and how you would be able to assist. But normally we automatically, you do need to let them know that there is a difference now. There used to be where we would send them to healthcare.gov and they would sort of automatically get in. They would have to go in and put their information in again, is my understanding that I've heard from all of the information. So just passing that on to letting them to know that they need to re-enter their information in healthcare.gov would probably be very beneficial.
Thank you, Gretel. Do we have other questions in the crowd? Linda?
So my question is about postpartum coverage, the continuous coverage. Now that the state plan amendment has been approved for that, as well as now we have a date for the end of the PHE or the end of the continuous enrollment, I guess more accurately. I know we had talked a while back about specific communications to that population, and I didn't know if you had been working on that piece as well. And if not, can we come back together now and talk about that?
Thank you, Linda. I appreciate you bringing that up. We are working on communication for that. I've actually gathered with our key staff from that program area. We are putting together the messaging. It's not uploaded to the website yet. I'll be honest, this was first priority. Now that today's meeting is in process, we will be able to focus a little more on that postpartum and getting the information updated to the website, but as well as getting information out to that target audience. So we do plan to have targeted communication, and we'll also put together some resources as needed. So I know our ACHNs are going to be working hard with that population, the maternity population. And so we have some pieces that we're putting together for our care coordinators to go out with that information. Thank you. Great. Any other information that you need to know in the room first? Okay.
On the postpartum, as you said, the ACHNs and the analytics team have been diving into the data to see, which individuals have a pregnancy diagnosis. So in our system that we have, and let me just say this, the postpartum is not just for Medicaid, it is also for all kids as well. So it's for all of the pregnant people in Medicaid and CHIP. And so the system has already had the opportunity to pick out which women are pregnant, and if they, and we'll use that information to go ahead and put their postpartum out there.
Okay, I'm going to transition just because we have a few minutes left. I want to make sure we get to some of the questions in the chat box. Two of the questions are related to the slides in the presentation today. Yes, we will be posting the slides on the COVID provider page. We're also going to be posting a link to this recording of this meeting. So if anyone that you were just thinking, I wish they had heard this, or I wish they had been a part of this meeting, they can listen in after the fact to the recording. And as always, if there's additional questions that come up, you can definitely submit those to us directly. We'll be happy to help out. So the next question is, will individuals scheduled for termination be reassessed prior to termination? Let me read that again. Will the individuals scheduled for termination be reassessed prior to termination?
Yes. Before we terminate somebody, we have to assess to see if they're eligible for any other program prior to termination.
If the facility has or can complete with the resident a Medicaid appointment of representative now, can the agency send the resident's annual renewal to the facility so that we can assist the resident prior to scheduled termination date? It has to.
Yes, we really encourage that. Our partners with the nursing homes, a lot of our COVID unwinding E&D population, they're on COVID because of no review was processed. So if we can work with our nursing homes to get those reviews done, we welcome that. And waivers.
Thank you. These are good questions. Can the card be available in Arabic and Korean? I'll have to go back and look at our list of most prevalent languages, but as long as it is in our top 15, I think it's our top 15, we have a contract or a vendor who can translate for us. So upon request, you just need to get in touch with us at the agency, preferably me, Melanie Cleveland, Communications Director, and I can get that information translated as long as the vendor has access to that translation. How often per month will Medicaid eligibility screen be updated? For instance, if a patient shows eligible on the first day of the month, will that patient remain eligible through the full of the month?
Yes, that's always the case.
Yes, always the case, is what Gretel answered. Okay. Will all renewals go out at once or in phases based on when they are scheduled for renewal?
They will go out in phases, and we try to keep them in their normal renewal month because that's when they're used to doing it. So in most cases, that's what it would be.
Okay, this question sounds similar. Is everyone in Medicaid in a certain renewal month, or is there a tiered process for renewals? Will Medicaid use ex parte renewals for all kids?
We are in the same system. So if a Medicaid person is, a Medicaid child is no longer eligible for Medicaid and they're over the income limit, and they would bump into the all kids automatically. It's in the same system. Was that both questions?
And this one is very similar. I think you're going to have a similar answer. Is if a nursing home Medicaid recipient did not complete a yearly review in the past couple of years, will they be terminated immediately, or will they be reviewed at the time of their next renewal date?
They will be renewed. Every person that's only on because of COVID will also be renewed.
If a member should lose Medicaid coverage and must complete the Form 204, 205, are we required to add the slot confirmation form with the application to the Medicaid office?
Is this a new applicant? You're saying they're, can you repeat that question? You said they terminated? So, okay. Are you saying that they are being, they did not renew? Oh,
They got to be able to hear it online.
That question refers to the waiver program and the slot confirmation. If they lose their coverage, then we need to know that they still have a confirmation to put them back on. So yes, they will need a new slot confirmation.
Are you saying they lose the coverage and then they reapply? Yes. Okay, because if they just are doing a renewal, they will already keep that slot. They don't need another slot. But they wouldn't have lost it during the pandemic, is what I'm saying. So when the renewal comes, they would still have coverage.
Say that again.
They would not have lost coverage during the pandemic unless they requested, moved out of state, or died. Okay, so they would still have coverage even though they're not eligible. Then you would do an eligibility determination. They are already in that slot, so you don't need another slot at that point.
Okay, a couple of questions in the chat about application assistor training. It is virtual. And the email address for someone wanting to contact, let me pull that up on the screen here for you and I'll read it as well. Marie Dean is the contact. She's the Associate Director of Training, and her email address is Marie, M-A-R-I-E .Dean, D-E-A-N, at medicaid.alabama.gov. The question is, can we still do virtual visits? I think that's referring to telemedicine. We are currently still under the public health emergency. Therefore, you still have telemedicine available just as you have over the last couple of years. Now, starting May 11th at the end of the PHE, there may be a change. So you need to be mindful of any policies that are released from the agency in the coming weeks. Would the training for the application assisters be applicable for skilled nursing facilities?
Yes, the application assistance training is for any facility that will be assisting our Medicaid recipients.
We have just a couple of minutes left, so let me go see what else we have. Can you elaborate on text messages to recipients and what that can include? This is no longer prohibited, correct? We did get some ruling from the a federal agency to let us know that text messaging is allowed. And we do plan to use that as one of our modalities. If we have a cell phone number on file, we would be able to reach out to that recipient. Here again, I want to emphasize that Form 295 or the use of the portal, those of you that are talking with recipients, either in a provider office or our partners, if they don't have a cell phone number on file, we can't text them. So it could be that they just have a name and address on our file. They may not have a phone number or a cell phone number or an email address. So if you encourage them to go ahead and add that information to their file with Medicaid, we have greater access to give them the information they need to know. Come on up, Kim.
I think that's going back to what Gretel was saying that was very helpful, that we were worried about because we have such a transient population. If they may have been somewhere and ended up in residential or the state hospital or somewhere, and you're right, after you're doing those 2 temps, they may not have that information. So then what is your time period that they, if you can't get in touch with them through those alternate, that they would be not renewed?
Gretel, you want to address the question about the time period?
Normally, we have a certain length of time that we allow, but we have something called a late renewal, and if they get the renewal in within a certain time frame, what's that time? 60 days. If they get it within 60 days, we still can go ahead and they would not get a change in their coverage. Kathy?
Getting my exercise today.
What about express lane eligibility for renewals?
We have what we call expedited renewals or ex parte renewals where the recipient does not have to do anything. We've had this for a while, which is why we've been able to keep a lot of our people on during the pandemic. We have something called express lane eligibility where we have a data match every month with SNAP and TANF. If they're on SNAP, TANF, or both, and they're a child under 19, we automatically renew them for Medicaid. We also have something through the federal hub called the RR, isn't it through the federal hub, Mason? Yeah, RRV. And so that's a re-verification process, and the federal hub will do a data match, and we can automatically renew people through that. And so we do that on a monthly basis for Medicaid and CHIP, and it's been very helpful.
I did see a question in the chat that asked, will we cover telemedicine after May 11th? This is part of the discussions that we're having internally. Whatever was normal before the pandemic, that's what you know is going to come back to afterwards. However, there will be potentially some changes to that. If there are any changes, we will give you advance notice. Most likely you will see an alert come out first, so make sure you're subscribed to those alerts, and you'll see the alert that will detail what types of changes would occur. I don't think we have any definitive response to give to that other than watch for alerts.
And just keep in mind, at the beginning of the pandemic, the CMS there were a couple of things that they were going to just stop right at the end that they said that they weren't going to renew. So we'll have to keep our ears out open for that.
Another question in the chat. How long do recipients have to renew their Medicaid coverage compared to when they receive the initial letter informing them that it's time to renew?
Normally they have 60 days. And I think some of the programs is 30 days and some of them 60 days. Is that correct? Okay. Depending on the timing of the renewal, but they will have adequate time. If they need an extension, they normally can contact their worker and say they need an extension.
Okay, I'm going to take one more question. We're actually a little over time. How can we find out when nursing home residents are due for renewal?
They can contact their district office representative. Each district office have workers that mainly work with that particular district office, but if they don't know who that is, they could just contact the manager of that office and they'll refer them to the right person or help them.
Thank you to all the Medicaid staff who showed up today to help answer these questions. Thank you to all of you in the room who attended. You made the effort to find a parking space and to navigate through the building to get here. We're glad to see your faces. For those that joined online, thank you for the time that you dedicated to listening to the webinar. We hope it's been helpful. We hope we've answered majority of your questions. I do know there are questions in the chat box we did not get to. We will attempt to add these maybe to our FAQs and maybe put an FAQ document out there on the website for any questions and answers that we've given today or did not get to. We'll try to provide those. Thank you again, and you have a wonderful day.